and welcome to Public Health Musings. I'm so excited to have you on the show for this month. I have a great person that I've known for a while, and we're finally catching up again. And we're going to talk about a fun topic that I still haven't addressed on this podcast. My name is Dr. Caroline Kingori. I'm a faculty member at Ohio University, and my focus is in public health, hence Public Health Musings. So let's go right into it. Today's guest is Dr. Lisa Borrero. I have known her since our grad school days at Indiana University, Bloomington. She's an associate professor in health and aging studies at the University of Indianapolis, and also has a PhD in health behavior, minor in gerontology, also from Indiana University in Bloomington, MS in counseling from Indiana University, Bloomington as well, and a BA in psychology from Ireland College. I hope I said that correctly. So Dr. Borrero teaches in both the Master of Gerontology and the Doctor of Health Sciences programs at University of Indianapolis. She teaches courses including physical dimensions of aging, psychology of aging, development and evaluation of health programs, as well as qualitative methods and analysis, among others. Her scholarly pursuits include qualitative exploration of self-concept among older women and the intersection of intergenerational learning and ageist attitudes, and also engages in online learning and gerontology education. So some fun stuff. I can't wait to dig into it and learn more about what you do. So welcome to the show, Dr. Borrero.
Thank you so much, Caroline. Glad to be here.
Awesome. So I know a little bit about your journey because, we went to grad school together, but, you have the psychology, you did counseling, then you did public health. So tell us about your journey and how you got to where you are today.
Mm-hmm. Yeah, great question. Sometimes I wonder about that myself. How did I get here? It's kind of one of those classic cases of where one thing kind of led to another. I knew, after I graduated from high school and, was getting into the realm of undergrad, I never had a particular profession in mind, but I knew that I was interested in people. That's just who I am. I'm very much a studier or interested in people and interested in studying people versus, say, the hard sciences or statistics. And so that seemed to naturally lead me to the study of psychology as an undergrad. Again, not with necessarily the idea of going into a particular profession. I kind of wish I'd thought ahead, but I didn't. And when I graduated, I still was like, what do I want to do? So I just had some, odd jobs for a while thinking about my future. And I thought, still a people person. I thought, let's think about how I can help people. And my mind went straight to counseling. And so I applied for a master's degree in counselor education and counseling psychology. And so I ended up getting a master's in that. And I thought, sometimes getting a degree makes you realize, maybe what you don't want to do. And although I enjoyed counseling, I thought, this is so heavy. And I think I would push myself so much into this. And I just thought that it would be perhaps a little too much. I thought I want to help people, but maybe not by doing therapy. So I utilized those skills in a more non-traditional way by going into higher education, administration in higher education. And I worked in the student services realm for a while. And actually, I really enjoyed that because it allowed me to grow as a professional. Because up until that point, I'd never had a professional role before. I had plenty of jobs, but it was more service related, working with adults with disabilities. But I never had a proper office job where I really had responsibility for a lot of things and represented programs. So that was great. Did that for a while. And then I realized, what? I don't want to do this forever. I need to go back into something that appeals to who I am, the working and helping people. And I always, and it sounds kind of, I don't know, cliche or silly, but I always loved older people. I loved my great grandmother so much. I just enjoyed sitting with older people, listening to stories. And it's spoke to me in some way. It just really clicked. And I knew that at my university, that Indiana University had a minor in gerontology. Now, if they had a major, PhD program in gerontology, that would have been perfect, but they didn't. They had a minor in gerontology within the School of Health, Physical Education, and Recreation, which is what it was then, and under the umbrella of the health behavior program. So I went ahead and applied for that because I thought, working on behalf of older people, within the broad realm of health really appeals to me. I feel like I can make a difference there with, who I am as a person, the things that I value, my work ethic, and my, love for older people and the place that they hold in our society. So that's what got me there. But I didn't, I didn't think, oh, I want to be a faculty member. I have this, I guess I suffered from not thinking the next step ahead. What do I want to do with this degree? I don't know. But I ended up going kind of the traditional faculty route. And I'm glad for that because I can, work alongside colleagues from around the country for whom this is also passion, gerontology, and older people in the aging process, but also with students for whom that is also something that's important to them or a passion in some way. So it's been a great run, again, kind of just meandered my way here, but I'm very glad that I did. And I love my work. So that's kind of the way I landed, where I am right now.
No, I like that story because I don't think all of us know that we are gonna, you have a path, obviously, and just like you, I studied in psychology. I wanted to be, first of all, just a generalist psychologist. And I was like, oh, maybe I can do some counseling. And then I found industrial and organizational psychology. I was like, this is perfect. And then I met public health while I was in undergrad. Then I was like, wait, what is this? Looks like more fun, more people, not just the one person, and the same thing that you're talking about. So I feel sometimes it's good when you can pivot, and you can sort of go with the winds, even though you do have a plan, but that plan is sort of getting you there, but giving you alternative options, And just like you, I never thought I would be a faculty, and here we are.
Absolutely. I never in my wildest dreams thought I would be, but I'm glad it's going to be here. I'm grateful for it.
Yes, the diversity of the profession, I think I find it extremely fascinating because then you're not just doing one thing. You're doing multiple things, and that sort of helps with minimizing, to a certain extent, getting tired or bored, with the mundane of the job. So you can change it up any way you want. So you talked about how you love, interacting with older people. They're always so fantastic and exciting, very honest. They tell you what to think. So this focus on gerontology and health promotion that you've been in for the past decade, tell us more. What is gerontology for those who don't know what that means?
Sure. So gerontology, one of the things I love about it, in addition to public health and health promotion, is that it's an interdisciplinary field. So unlike something like geriatrics, which is much more, within the health field or the medical model, where you're looking at the physical aspect of growing older, gerontology looks more at the study of aging from the societal perspective. Now, it doesn't mean that it can't involve the body, but it's more of what does it mean to grow older in our society? What does it mean to be an older person right now? What kinds of policies and programs do we have to aid and assist with the aging process? What role do families play in that? So all of those kinds of concerns are at play, and it can involve folks from sociology, psychology, all across the spectrum of disciplines that involve looking at our world and people within it, can intersect with gerontology. And that's what's so great about teaching in this field, because now if I were teaching in a gerontology, a Doctor of Gerontology program. I would probably have more students for whom they want to go on to be a gerontologist, but I'm teaching in a Master of Aging Studies program. So we have a lot of students for whom their major area is something else, say physical therapy or occupational therapy or psychology or something, but they understand that to learn more about the aging process and about the unique concerns of older adults will help them in their fields, because say they're a physical therapist who's going to have older adult patients and their families. They want to understand how better to serve them. So it's very interdisciplinary in that way. And we certainly draw from all those other fields to inform how we teach about aging. So I teach a course in psychology of aging. And while I'm not teaching about psychology per se, it does intersect in many ways. So there are, psychology of aging courses, perhaps within psychology departments, somewhere where you have maybe a faculty member who has a background in gerontology. So that's what's really fun about it is the interdisciplinary nature of it.
And I truly enjoy any discipline that has that ability, to cross across the aisle to the other disciplines. And looking at gerontology and all these intersections that it has, you're also focusing on health promotion. So what is that relationship like between gerontology and health promotion?
Well, that relationship is pretty direct. I mean, it's direct because, and I'll continue to talk about this probably throughout the conversation, but we're all aging. We're aging right now. You and I are aging. Children are aging. We're all growing older, and our behaviors that we engage in when we're younger, from childhood throughout young adulthood and such, will have an effect on us when we're older to a certain extent, depending on what they are. So health promotion is really always at play. So we think about health promotion related to aging in terms of how do we promote health among older adults? So that's important, of course, those who are already older, but then also health promotion for younger people with the understanding that they are getting older. How can we promote health in their older years now? So to me, they go hand in hand. And as you know, health has so many dimensions, depending on the author that you're looking at, 5 or 7 dimensions, and there's wellness too. You can come at this from any angle, no matter what aging class I'm teaching. Health is always a part of it. If I'm not maybe necessarily using the word health, but we're talking about maybe socialization. We're talking about physical functionality. We're talking about families, intelligence, and cognition. All of that has to do with our health, and it all connects to form our overall quality of life and concept of health. Everything's interconnected. So when you look at gerontology, it's a field that really must include health promotion in some way. And of course, we're always beating the drum of, look, the earlier you start talking about health promotion and being preventive in your habits and engaging in good nutrition and physical activity, all of that, the better your quality of life will be when you're older. So in a way, anything that's related to health is kind of related to gerontology, if you think about it, because it benefits us in the long run. So that relationship is pretty solid. It's real clear.
I like that connection. And it takes me back to sort of that human development that, we learned in psychology or in Health 101. And again, the importance of focusing on this aspect of the population. Because many times I think we tend to only look at the clinical aspect of the aging process, and we forget everything else that you're interested in. And we'll segue to some of those things. I know that you're interested in self-concept among older women, you're interested in the intersection of intergenerational learning, those ageist attitudes. So what do we need to know about the self-concept of older women? How do we perceive ourselves, right?
This is probably one of my favorite topics. And, of course, working at a teaching university, I don't get to get out there and do my original research as much as I would like. I would love to do a lot more about this. Maybe when I go on sabbatical, I could do more of the original research, but I have done a little. But what's interesting to me, apart from being a woman myself, about the self-concept of older women is that the experiences that inform self-concept among older women, which is a broad concept, of course, in and of itself, are unique from men in many ways. Especially when you think about this particular cohort of older people, their experiences, coming of age are different than our experiences, or, my children's experiences are going to be. So what I will say might not apply in the same way to other cohorts coming up. But so the experiences impacting the self-concept of older women, were formed initially, during a time when there were very specific expectations for women's roles, regarding, childbearing, motherhood, workforce participation, all of that. And, that has informed their self-concept now, and then what they're going through now. And this relates to a concept that we talk about in gerontology called the life course theory, or the life course approach, which is essentially, that what we experience, throughout the course of our lives, impacts our experiences when we're older, such as, the health example I gave earlier. But so the self-concept, what I see a lot in the research regarding older adults now, older women now, is this idea of resilience. It's my favorite part of studying this. And not that men don't have resilience. It's not that. It's that, women have resilience in response to those unique experiences. And the resilience reflecting, their ability over time to respond to, withstand, move past, continue on after life's challenges. And women have shown time and time again that they have a unique ability to do that, given, again, this cohort's unique experiences. And part of self-concept, of course, again, there's many components that I've looked at before a little bit, is, body image. That's interesting to me too, because we as a society in general place very unique, stringent, and unreasonable expectations on women in terms of appearance, how they should look. And women, of course, are not immune to those messages. We all take this in whether we want to or not. And I have two daughters. I talk to them about this all the time. Like, don't believe that stuff. But I'm not naive enough to think that they won't, drink those in. But so it's interesting, though, among the studies that I have read regarding self-concept among older women now, is although women have developed this resilience and are indeed, older people tend to be happier than younger people because of this ability to adapt and be resilient. And older women are able to have a sense of self that is apart from this idea from when they were young that they should be judged based on their appearance. So older women are able to say, look, I understand that my sense of self is more than just that. I have these accomplishments. I've done these things. I've overcome these challenges. Maybe I'm a very intelligent, capable person. And they see that as perhaps more important, rightly so, than these unreasonable expectations put on them when they were young. However, research also shows that this idea of body image and how we may self-objectify, it's complicated still when we're older. Because even though many of us can kind of get past that when we're older to understand that we're more than that, they're still not immune to, having those other messages still in the back of our heads. So some of the research I've looked at, some of the qualitative research, you see quotes of women saying, I know I'm capable, I contribute to society, people need to understand that, but I still don't like looking in the mirror sometimes and seeing these wrinkles and seeing that I have aged. So it's a real, almost like a dissonance there where, older women truly do accept where they are in life and who they are and how they look, but it still can be tough at times, which I find very interesting. And even I can experience some of that from time to time. So I'm starting, as I get older, I'm starting to understand a little bit how that feels. There's this concept that you read about sometimes of the invisibility that older women start to feel in their 40s, kind of approaching 50 in society, that once they're no longer seen as this, can be objectified, physically, that they start to be, not as seen. So that can certainly weigh on a person. But I do find it interesting that there's that interplay between sort of an idea of empowerment, but yet also having that kind of internalized idea of what I should look like. So anyway, but I do think that as the cohorts continue to grow, as our generation gets older and then the generation after us, I think some of that hopefully will continue to evolve, because now, at least, in our society, we're seeing more images and more of an understanding or acceptance of the idea that, more body types. We want to see more body types. We understand that we're all different and we're all valuable. So I'm hoping that those messages will inform women as they get older, so that we have less of the internalization of those negative stereotypes and more of that feeling of empowerment.
And I like that example that you've provided, because it shows, again, the challenges of dealing with perceptions, right? Societal norms and societal collective thoughts about how we should be, regardless of gender or race or what have you. And so there's always that internal, external conflict. And it's not, I really appreciate how you brought that out, how you taught us what that self-concept looks like. I mean, I would love to be in your class and learn more about that. So,
can I say one more thing on that? You mentioned something that made me realize. I will say that the reality is in the research, and this is based on a couple of years ago when I was more into this research, that I'm sure it's still the case. The vast majority of the research on older women and self-concept or body image, there's not a lot. It's mostly on younger women, college age. The vast majority is on white women. So, and the little bit that's out there has suggested that there are, cultural differences. So there's more work needs to be done in this area to look at women, across cultures, experiences, to see how this plays out among all women. So such is research, right? We have to expand.
Yeah, that would be a great way to understand even, urban, rural, all those different kinds of contexts. It would be great to see what kind of differences come up with that. Mm-hmm. So the other thing is this intergenerational learning. What is that? I saw the term and I was like, ooh, this is fascinating. I kind of feel like I've seen it on TV somewhere where young people are coupled with older people, but I don't know if that's what that is. But yeah, tell us, what's intergenerational learning?
This is one of my favorite things, and I wish I had more of a chance to study this, be involved in this. I have a lot of interactions with colleagues about this, but I just wish there were more time. So I'll try to make this brief. But so intergenerational connections, learning, and ageism. So first of all, I think ageism as a term isn't necessarily widely known, but I think people tend to understand that, older adults and aging, the process tends to be something that people are not too excited about. This idea of getting older We tend to resist it. And as such, older adults historically have been very marginalized and put to the side or othered, treated as an outside group, something to say, I'm not that, you're older, I'm not, I'm over here. And we see this throughout our culture. It is something that is certainly not in the front of people's minds in terms of something that needs to be dealt with. In fact, it's something that's quite accepted, at least in a humorous kind of way. All the over the hill cards and, oh, that Britney Spears song came out 25 years ago, I'm so old, or whatever. We just tend to think that mocking old age is okay. The problem with that is that really serves to feed this idea of older adults and aging as something to be avoided. And that's very harmful to older people. And it informs a lot of the kind of institutional ageism that we see. There's a lot of ageism in healthcare and housing, and I could go on. So, and the reality is that ageism, one of the things that kind of promotes this at an individual level is lack of interaction with, another generation. When I taught primarily undergrads in my previous institution, a lot of them, it was an elective that they could take. A lot of them did espouse sort of ageist attitudes, not on purpose, not in a mean way, but more like stereotypes that they held to be true. But they all loved their grandparents. And their grandparents were really the only older people that they ever interacted with. And I would suspect that's true for maybe a lot of people, given our society and how we don't live close to our families much anymore, but maybe we talk to our grandparents. And so interactions with older people, meaningful interactions, can help to break down those aging stereotypes and reduce ageist attitudes overall. However, our society truly is quite segregated age-wise. There are places that children go, there are places that teenagers go, and college students, and middle-aged folks with working people, and then older people. And there are very few places in which you'll see an organic mixing of ages and interactions of older people with younger people. So, of course, that's a huge societal change. I mean, I don't even know how to problem solve that, but that could be something that communities can work on, and some communities have. But so having deliberate interactions and exchanges with older people that are not based on younger people helping sad older people, which serves to reinforce this idea of older people as helpless and sad, which isn't a stereotype that we want to reinforce. So having exchanges and interactions where, say, older people and younger people can work together in an equal way to solve a problem. Maybe they're working together in a community garden. Maybe they're working together to solve some type of issue in a community. Maybe it's a college class where they're researching an issue together and they present it together. And I've done some of these service learning projects where it's very much a reciprocal exchange. So that's what I'm interested in, is how can we, improve and increase the amount of interactions between the generations, with the end goal of increasing understanding. Because certainly there's ageism the other way too. The older people think, oh, those young kids, and have assumptions about them too. So anyway, I'm in my professional organization. I'm a member of I'm co-chair of a smaller interest group, it's intergenerational learning group for shorthand, is what we're calling it, where we talk about this and we promote this in our classes and we do research on it and we have workshops. And so little by little, we're learning from one another how to do that. So that's my main area of interest. I just wish I had more opportunities to get out there and do it. There's so many fun things to be involved with, but that's the crux of that research interest, is really promoting the breaking down of ageist stereotypes via those meaningful interactions.
Wow. I so love that. And I just love the passion that you have that makes this topic even more exciting, because so many of us don't understand, so much about gerontology, but we know that there are links and connections and relationships between, certain age groups with the health issues that we focus on. But I really like the knowledge, the new knowledge that you're, bringing and creating awareness on why we need to focus on this. So when you look at all those issues and your focus in health promotion and then also just the overarching public health, how do you see that intersection working or playing? And how can that be helpful for those of us who are in public health?
Well, the experiences of older adults is a public health matter for sure. It's, as I mentioned before, we're all aging, like all the time. So the concept of aging applies universally. So that's kind of the beauty of it is, anytime I, try to impress upon someone the importance of touching on aging related to really any subject, I say, aging is a universal phenomenon. It affects all of us. So, if we're lucky, we'll all be older one day and experience aging ourselves. But also, as we age, we have parents, if we still have parents who are living, we have parents who are getting older. So through them, we kind of experience what it's like to, be an older adult in this world and what it's like to negotiate, the healthcare system, housing, transportation, you name it, through, having them as a parent, if, depending on, how close we live to them and how much we engage with them. But if we're engaged with our older parents, we see this, we are exposed to this before we ourselves are old. So, as you know, our health is much more than just physical health. So, this being a public health issue really can't be overstated. It's important. Well, and I'll say one of the things I'm involved in is kind of ties into this. There's a new, newish over the last 10 years effort across universities, and it's becoming more widespread due to the professional organization I'm in, called age-friendly universities. It started in Ireland about 10 years ago, and there are about 100 or so universities who have signed on to be age-friendly universities. The idea there is that public education, the higher education, and that sphere, the education itself, the campus, the activities, shouldn't just be limited to younger people. Now, that's not their spiel. That is mine. But it's underscored by these 10 principles. And that's how I like to see it, that this sphere should not be, older people shouldn't be excluded from it. So we look at how older people can engage with lifelong learning, how they can engage in additional degree completion with the arts and culture, but also how you can insert issues related to aging into really any discipline, because again, it's universal. There are ways in which aging applies to really any subject, but folks don't know, it's not in the forefront of their mind usually, unless it's maybe a related accreditation in, I don't know, a physical therapy program or something where they have to talk about older people and their particular concerns. So this is one example of where I have to, along with my colleagues, kind of make the argument that aging and older adults are relevant. And so, I think it's pretty clear in public health, that connection, but it's also very connected in other arenas in life because aging is universal. So, and education isn't just about people getting a degree, and it's changing so much too. Higher education doesn't look like it did 20 years ago. And because we've got this, population that's booming, it's more of it's more relevant, and it's an opportunity. I mean, unfortunately, these days we have to paint these things that we're trying to convince people of in terms of the opportunities for them. But it's true that universities, this is an opportunity for them to capture the interest of a population who wants to be involved, who can, pay some to have another, what does someone call it? A micro credential, or another degree or something. I mean, I think I heard a statistic in my two graduate degree programs that I teach in, that the average age of our students is somewhere in the 50s. And that's because a lot of them are post-professional, that they are currently working. They might have, many of our students have families. And so they are themselves, on the older, non-traditional age. And some are in their 50s and 60s. So, it's just, things look different now. And aging is really part of our reality. So I think, convincing people of the relevance of aging to any sector is important for us to do as gerontologists, and hopefully we can get more people on board to help to convince people too, because it's not just gerontologists. Like I said, people from different disciplines intersect with aging directly. Maybe they can help make that argument too.
Yeah, I like that perspective, and I didn't even think about it, but I realize now that the online programs we have really speak to that non-traditional group of people. They have families, or they're coming back to school now, or etc. The flexibility. And I think that with the booming of the online education, it has really lent itself to bridging that gap, because in the past we just had all these young people graduating. But now the trend is moving where we have a mix. And now, as you said, 50% of people graduating your institutions are, in the older generational gap. That then is, we need to start thinking about the kinds of services we offer, and, student services, career services, or what have you, to help meet the needs of this particular group of people. So since you're used to teaching online, I was wondering, did COVID affect you? Because the rest of us had to pivot and had to change, and students, I mean, it's been dramatic.
Yeah, no, that's a great question, because I think COVID changed so much for so many people. I mean, higher education was just turned upside down. But because the two programs I teach on are 100% online, not a lot changed. Well, with regard to the way I teach or how I was teaching it, it didn't have to. What changed, and not necessarily dramatically, but was, and the folks in my area, were our responses to students and how we interacted with them. Because in the programs I teach in, although they're not necessarily all health focused, a lot of our students work in the health care field in one way or another. We do have a lot of physical therapists and occupational therapists, and those who work, in those kinds of settings where they're working with patients. So for those individuals, life got really hard, really fast, and very stressful. And many of them, were getting diagnosed with COVID early on, when it was really scary. Not that it's not still a concern, of course, but early on, it was incredibly frightening because we didn't know what we were dealing with, and we were seeing, so many stories about deaths due to COVID, and it was very frightening, especially for those who came, in contact with it much more often, because they still had to go to work. So the way that we responded to those students who were in those situations is more of what changed for us, that we were more in contact with them. We made a plan for all of us in our department. We reached out individually to all of our students, checking in with them, seeing how they're doing. We're more flexible with deadlines. I mean, prior to COVID, we have deadlines that are firm, and policies about that. But of course, we were much more flexible and understanding, because this is, everything was unprecedented. So that's really what changed, was our interactions with students, our support was much more immediate, and our, level of understanding and engagement with students in terms of when they could complete things, that's what really changed. But in terms of our approach to teaching, not a lot was different, which was kind of nice because, and probably other universities did this too, but those of us in our area who teach online were asked if we wanted to, and we all said yes, to serve as, I can't remember what the term was, but basically we were coaches for the faculty who taught face-to-face but had to turn on a dime and then teach online. So we were assigned a handful of faculty and we served as their, guides or, mentors, if you will, in this process. So we would help them problem solve, help them with ideas for setting up their lessons and how they could interact with their students. I had one faculty member who taught a softball course, for athletes. And she said, how can I assess their ability to, I can't remember what it was, something about throwing or pitching or something, catching. And so we talked about how you could do, videos, how they could record and all of that. So instead of changing on a dime like other people had to do, we stepped in and supported those who had to change what they were doing teaching-wise on a dime. And that was nice to be able to serve in that capacity because we had a lot more experience than a lot of other faculty did, and we were able to help.
I like that, so you basically they found other ways to make that whole experience make sense to you guys, but also you served, right? Mm-hmm. And were able to help other individuals. We're still coming out of the throngs of COVID now that we just have to learn to live with it. Right. But I have appreciated just how challenging it is to do online education, and really the creativity that comes with that. It's not business as usual, but it's good. So as we start winding down, I just have one question that I always ask my guests. So, in your life or in your work life, personal life, what's one or two memorable things to date that you can recall?
So, okay, let's see. I'm trying to think in my work life, because that's what we've been talking about. Well, there's a lot of things that I just love about what I do, but something that was so wonderful for me to discover, how I mentioned that I'm so interested in intergenerational relationships and looking at that and studying it to the extent that I can. My professional organization, the Gerontological Society of America, there's an educational arm of that, which focuses on gerontology education. So that's kind of my primary home within that very large professional organization. But within that smaller section, we have interest groups. And years ago, after I'd been attending the conference for, maybe 3 years, I found, I don't know why it took me so long to find it, an interest group, the intergenerational learning. It was called something else then, but it was based on intergenerational relationships. And I found that group and I said, I found my people. I'm so glad I found my people, because not only, of course, do we care about older people in the aging process because, we're in this professional organization, but these are people who wanted to promote this very important component of education and societal interaction and debunking of ageist stereotypes. So that was a real highlight for me. And these people who are from across the country, different universities, have really become my most trusted colleagues, apart from those that I work with in my university. So that was really one of my favorite times when I discovered these folks. And I feel so lucky because I have such a wonderful core unit of people I work with in my department. It's such a functional, wonderful, place to work. I feel very fortunate. But then I have this other set of people that I could call on if I have questions, like the age-friendly universities. I've got a couple of those folks teach at universities that became age-friendly, and they had a hand in that. So I could call up my friend from Connecticut and say, how did you make this work? Can I pick your brain a little bit? The woman from Boston, another woman in Oregon. So it's just wonderful to have that. So that's a highlight of my, professional life. But, and personally, now that I'm spending more time working from home, it's very nice to be able to be present for my kids. So I feel like if the pandemic gave us anything positive, it was this idea that, hey, people can be productive working in a different environment. And I know that not every employer is, allowing their employees to continue working from home, but some, I think, have come to understand that they can be a little more flexible, and that they can get just as much productivity, if not more, out of their workers. And for me, having that flexibility, and I'm lucky that I had it before to a certain extent too, but being able to be present for my children, going to school and coming home and all of that, having a flexible schedule has been very wonderful for me. And that intersects with my professional life. I'm very lucky to work in a job that allows me that autonomy, in a reasonable sense, to be able to kind of, dictate at times, how I make my schedule work for me. So that's been really nice. That's a high point, because right now I'm in that stage of life where I've got school-age kids. So my work is important, but also that part of my life is very important too. So marrying those two in a way that works for me is critical. And I've right now I found a way to do that. So I feel very fortunate and very, very happy with, where I am right now. So yay.
I've really enjoyed talking to you. And I'm definitely looking forward to, tapping into your knowledge down the line, maybe next year or sometime this year. And we can talk more about, what else you've learned about this gerontology process. There's so much to know. And now I'm like, oh my gosh, I can't wait to go and research a little bit more about that, because you've piqued my interest. So thank you for coming on the show. Yeah.
Well, thank you for having me. This has been a lot of fun. I love how we've, been able just to have a conversation. It's very comfortable. This is wonderful. You've got a really great podcast going here, and I'm glad to have been part of it.
Great. I am so excited. It's always nice when I can call on my friends. I remember, when I was just new at IU, had moved from this metropolitan town, and I'm like, oh my God, this small town. What am I going to do with IU? Yeah, so it was nice that, to have such a great cohort. I can't say that enough. I mean, the 3 years that we went through, hectic years that we went through the PhD program, you guys and your social support and the opportunities to laugh and be there for each other, with all the challenges and the opportunities and the good times that we had. Oh my God, it's so exciting that I get to
I agree. It was a great group. And I love that we were all studying different things. We all had those different minors. And I was like, these folks are studying, sexual health, and we have gerontology, and then the folks are studying, drug addiction and things. I can't remember what the other ones were, but
nutrition.
We all had our own little areas.
Mm-hmm, mm-hmm. And that really helped with the diversity of the information from this one program,
Yes.
and everybody graduated successfully.
I know. Well, I wonder what the program looks like now, because I know it's totally different. Even when I go to the website, which is not hardly ever, I don't even know if they have a program called health behavior anymore. I'm not really sure. But it's now that it's the School of Public Health, it's very different.
Exactly. So thank you again for coming on the show, and thanks to the listeners and the viewers. And I'm definitely looking forward to having the viewers and the listeners back on the show, and you as well, Dr. Borrero. Hopefully you can, tap in every now and then. But it's so exciting that we were able to do this, and I'm wishing you the best as you enjoy the rest of your summer,
Thank you so much. You too, Caroline. I hope that you, Dr. King Lori, I hope that you, sorry, that's familiarity there, that you have a wonderful rest of your summer and have more exciting guests and learn a lot. That's wonderful. You get an opportunity to interact with so many different people studying so many different interesting things. So best wishes to you on your interviews down the road.
Awesome. And viewers and listeners, don't forget to like the show on YouTube and leave your comments as well. I always look forward to interacting with you.